The human body has over 100,000 miles of blood vessels, and there's one incredible nerve that acts like a master control switch for this entire cardiovascular system. Today, we're exploring how this single nerve can mean the difference between life and death in the operating room.
That's fascinating about the vagus nerve. And you know what's really interesting? It's one of the few nerves that can instantly override our heart's rhythm.
Exactly right. Think of it like having a universal remote control for your heart. When the vagus nerve releases acetylcholine, it's essentially pressing the slow down button on your cardiac system.
So, how exactly does this chemical messenger work? I mean, it must be pretty powerful to control something as vital as our heartbeat.
Well, it's actually an incredibly sophisticated process. The acetylcholine, or AC as doctors call it, has to dock at these special receptors called M2 muscarinic receptors. Think of them like specialized parking spots that only this one chemical can use.
Hmm. And these receptors are located in some pretty crucial places in the heart, aren't they?
Oh, yeah, they're right in the heart's natural pacemaker, the sinoatrial node, and in the atrioventricular node that helps coordinate electrical signals. But here's where it gets really interesting. When AC connects to these receptors, it triggers this amazing cascade of events.
You mean like a biological domino effect?
Exactly. First, it activates these proteins called inhibitory G proteins, which then suppress an enzyme called adenylate cyclase. This leads to a decrease in something called cyclic AMP, which affects these incredibly important channels in the heart cells.
Let me guess. These are the famous funny channels I've heard about?
That's right. And despite their quirky name, they're absolutely crucial. When cyclic AMP levels drop, these channels slow down, and there's less calcium flowing into the heart cells. But there's more. You also get these GIRK channels opening up.
And what makes these GIRK channels so special?
Well, they let potassium flow out of the heart cells, making them more negative, or hyperpolarized, as scientists say. It's like adding an extra pause between each heartbeat. Recent studies have shown this can slow the heart rate by up to 20 to 30 beats per minute.
That's remarkable how precisely this system can control our heart rate. But I imagine this could sometimes cause problems during surgery?
Oh, absolutely. In fact, statistics show that about 15% of surgical procedures can trigger an extreme vagal response. Things like laryngoscopy or pulling on internal organs can cause the heart rate to drop dangerously low.
So, how do medical professionals handle these situations?
They use this fascinating drug called atropine. It works by blocking those M2 receptors we talked about earlier. Studies show it can reverse severe bradycardia in less than 60 seconds when administered properly.
That's incredible response time. But what about this other drug, dexmedetomidine? I've heard it does the opposite.
Right. And this is where things get really interesting. Dexmedetomidine enhances vagal tone, potentially slowing heart rate by an additional 10 to 15%. Recent research shows it's being used in about 25% of major surgeries now.
You know what I find fascinating? How this same system that can cause such challenges during surgery is actually essential for our everyday well being.
Exactly. And recent research has shown some amazing connections. For instance, people with higher vagal tone tend to have better emotional regulation and stronger immune systems. Some studies even suggest it might play a role in reducing inflammation throughout the body.
That really shows how interconnected our body systems are. How does this relate to things like stress management?
Well, here's something interesting. Researchers have found that deep breathing exercises can increase vagal tone by up to 40%. It's why practices like meditation and yoga can have such profound effects on our physical health.
So, in a way, we can consciously influence this unconscious system?
Precisely. And the implications are huge. Some hospitals are now using vagal tone monitoring as a predictor of patient outcomes. Data shows that patients with stronger vagal tone have up to 30% better recovery rates after major surgery.
That really puts into perspective how important this system is for our overall health.
And looking to the future, researchers are exploring some fascinating applications. They're developing new devices that can stimulate the vagus nerve to treat conditions ranging from depression to autoimmune diseases. Early trials are showing promise with success rates around 60 to 70%.
That's such an exciting development in medical science.
Indeed, understanding this delicate balance between our nervous systems isn't just academic. It's opening up whole new approaches to treating disease and maintaining health. Whether you're in an operating room or just trying to manage daily stress, the parasympathetic nervous system plays a crucial role.
That's all for today's episode of Optimal Anesthesia Insights. And as always, stay tuned for more episodes where we break down key anesthesia concepts in a way that's easy to understand and clinically relevant. Remember, learning fuels precision. For a more in-depth understanding, check out our detailed descriptive video and updated text with references on optimalanesthesia.com. Thanks for listening, and see you next time.